Hello, and thank you for joining us today. My name is Keith Knabb, and I'm the owner and founder of Affordable Medicare Solutions. We are Georgia's #1 Medicare planning agency, and we have 9 employees, and we were founded 26 years ago. So we have lots of experience in different topics with Medicare, and I love to teach. And today's topic is traditional classic Medicare versus the new modernized or advantage style Medicare. So let's jump right in and see what we can learn today. So here's the problem. Let's go back to 1965. The problem was seniors didn't have health care at retirement. So the government decided to create a few programs to help seniors upon their reaching age 65 or even earlier. So Medicare is a federal program. The US government put this together and it's distributed throughout the United States, and it is run by the Centers for Medicare and Medicaid Services, called CMS. Remember, Medicare is one program and it's not the same as your employer group insurance or veterans benefits or Medicaid. Medicaid is another program that was created in 1965 for primarily low income or indigent individuals. Now, Medicare is also not the same as the Affordable Care Act. You cannot have Medicare alongside an Affordable Care Act plan, but you can have Medicare alongside your employer group insurance. It can coordinate together, also with veterans benefits, and also it can coordinate with Medicaid. So you can have Medicare with group insurance, veterans benefits, or Medicaid, but never with the Affordable Care Act. So in 2003, the Medicare Modernization Act was created to modernize Medicare, and it took 2 years to get it implemented and distributed out to the public. So in 2005, this versatile system was created to give seniors options. Pay attention to that word option. And Medicare is also basically gently modernizing over 2 decades from 2005 to 2025. Well, let's compare that to the Affordable Care Act. The Affordable Care Act pretty much did everything in a very compact, short time window, and we had a lot of disruptions. If you hear about hospitals and doctors arguing about things, it's usually under the Affordable Care Act, but not Medicare. Medicare has been very stable and has been doing gentle changes that have been very effective. So you have pathway number 1, which is traditional Medicare, and pathway number 2, which is a new modernization effort that is optional. So let's go back a little bit before 2005, back into the 1970s. Insurance companies saw that Medicare was created, but heard of complaints about gaps in Medicare. And so they created these small insurance policies that are designed to pay for what Medicare leaves behind. And they got nicknamed Medigap for filling in the gaps of Medicare. These are very efficient and effective little insurance policies, and they run at a very low price, about $120 to maybe up to $230 or so per month in Georgia. In other states, they can be quite a bit higher. This supplement makes no decisions on your health care. It lays quietly in the background. Medicare makes the decisions. Medicare is the primary coverage. And that also means that your hospital and doctor do not need to join a network to get their payments. These plans have been going since the 1970s and are very, very popular. Your coverage does also not change throughout the United States. So if you have a home in Georgia and a home in Florida, that's fine. If you're traveling, that's fine. And some of the options under the supplements, not all, but some, provide international coverage because Medicare does not cover you outside the US and US territories. So the new modernized plans called Medicare Advantage, those plans are where you see Medicare has now implemented similar things that they've been doing in group health insurance. Medicare said we needed to try out networks of doctors so we can steer people to certain primary care and certain specialists and hospitals. And those are called HMO, which means Health Maintenance Organization, or PPO, which means Preferred Provider Organizations. Very important difference. HMO means mandatory network. PPO means optional network. It means it gives you freedom. So pay attention closely to your plan if you do look at Advantage programs. But there's also some other types of Medicare Advantage programs that are very small categories, but are growing. And some of those are open networks, which means there's no network, called PFFS, or special needs plans, SNP, which means they are designed for low income people or chronically ill individuals with certain health conditions, and also Medicare savings accounts, MSA, very similar to health savings accounts. Those are a new category, pretty interesting. These plans are allowed by Medicare, not mandated, but allowed to offer extra benefits. So most of the plans, the typical plans in the market, will offer you some sort of additional benefit for dental, maybe cleanings, x-rays, or maybe full dental, vision care, maybe free eye exams, maybe also free eyewear, transportation, not just an ambulance, but just getting a ride to the doctor and back to the pharmacy and back home. Hearing aids. Some plans are giving great coverage under hearing aids. Free meals delivered to your home after you've been in the hospital. That's really neat. And some plans are also providing groceries to low-income individuals so that they eat healthy. Over-the-counter items. Medicare doesn't pay for Band-Aids, vitamins, or sunscreen, but those are things you should be using. And those are medical items that some plans now consider over-the-counter medical care, and they provide those to members for free, no charge, delivered to their home. And under the Medicare Advantage system, there are no pre-existing conditions. There's no health questions. They don't ask if you smoke. They don't ask if you are overweight. They don't ask if you have a heart problem. There's no health questions. And most of the Medicare Advantage plans do offer international coverage. So you have peace of mind that if you go on a cruise, you do have extra coverage. But there are rules, and you can typically only change these plans at the end of each year, or January, February, and March. They give you a one-time mulligan that in case you forgot to do your annual review, very important to do the annual review, but if you forget, you have a chance to fix your plan one time during January, February, and March. Now, if you have other special things that happen to you, such as moving to a new house or having other special circumstances, there's a list we can take care of this for you. You're allowed to move during the year, but that has a special circumstance. But let's make it even easier, because people always say, well, wow, that seems like a lot of information to take in, the difference between traditional Medicare and modernized Medicare. How do I make a decision? Because I have some friends that are telling me go traditional, and other friends saying, no, the new plans are the best things since sliced bread. Well, how do you make a decision on this? It's pretty simple. Pay attention to this chart, and I'll try to explain that you have to decide, what doctors can I see? How much is this plan going to cost me each month out of my budget? And the third column is, what is it going to cost me when I get sick to get better? So what doctor can I see? What do I need to budget out of my monthly income? And then what do I need to expect when I get sick to pay to get better? But let's make it even easier. Let's go to the very left-hand side, and it says you can either prepay for your health care with a supplement, or if you go down to the bottom, Advantage, I can pay as I go along. I can pay when I need care. There's no such thing as a free lunch, right? You either pay now or pay later. Your grandmother taught you, hey, there's no such thing as a free lunch. Prepay for what you need or pay when you need care. And this is why people get confused, is that some people say, I went to the hospital and I paid nothing to have my new hip put in. Well, they probably are on a Medicare supplement. They got to look at any doctor that takes Medicare nationally. They're paying a premium each month, like maybe $100 to $150 per month, plus a drug plan, maybe $20 or $30 per month. And then when they went to get care at the hospital or the rehab facility, they didn't have a bill because they had already sent their money off every month for the last 2 or 3 years to the insurance company, and the insurance company is obligated to pay their bills by a Medicare contract. If you go to the Advantage system, this is where the insurance companies are taking care of you and have fantastic coverage. You would want to look at your provider network first. Most plans have a network. Probably want to look at an open network that gives you access to any Medicare provider nationally, just in case. And these plans typically cost 0 premium per month. Still have your Medicare premium, which is a separate issue, which runs about $150 per month, but the plan does not charge you a premium on 85% of the plans in the market. And people say to me, Keith, how can you have a good plan if it's $0 per month? Well, remember, Medicare is funding these plans at about $950 per month per person. Huge funding. So that's a lot of money for the insurance company to get to provide you with service. But you're not going to have free healthcare, because when you go to the hospital, you're going to pay a copay. Maybe it's $300 to stay overnight in the hospital. You go to the emergency room, typically it's going to be about $90, but it might be a $5,000 emergency room visit. You paid $90. If you go and have a terrible year, have a stroke, have cancer, something else, you're protected. You don't have unlimited medical bills. There is a cap on what you have to spend, and that cap can vary. This year is around $7,500, but your plan can be much less than that. Some plans are only $4,000 or $5,000 annual max. So pay attention to that maximum when you do your annual review. Modern innovations. Who would think that preventive care is a modern innovation? I don't. Every health plan I've ever had in my life has annual physicals, annual checkups. But Medicare did not cover this until 2005, and they first tested out preventive care under the Advantage system. It's just a few million people at that time, back in 2005 up until 2010. And they decided in 2011 that everybody under Medicare gets preventive care. And it's a lot of preventive care: colonoscopies, pap smears, mammograms, physical exams, help you to stop smoking, help you with weight loss, but it doesn't cover everything. So your doctor might do a few extra things, and you might have to pay a little bit out of your pocket for some testing or some other things if your doctor wants to do more elaborate preventive care. Number 2, a modern innovation is gym memberships. Who would think that's modern? Well, for healthcare, it is. Gyms have been around forever, but Medicare does not pay for gym memberships. A lot of Medicare programs do cover for you to go to the gym for free. This was pioneered back between 2005 and 2010, and they found out that if people did use this free membership, that their healthcare spending went down by 30% for both medical and pharmaceutical. So it's a no-brainer, but Medicare doesn't pay for it. Medicare allows the Medicare HMO or PPO to provide that service if that plan wants to. It's not guaranteed every year to be in there, but it is under most plans. They do provide some sort of fitness benefit. Some Medicare supplement plans also decided to offer that benefit as a free service. Very few, a couple of them do that. And there are some big programs that provide it. Now, Medicare does not also provide dental, vision, or hearing aids. Doesn't do it. Now, if you have an eye disease, let's say you have macular degeneration or you have retinal detachment, that's a medical problem. And yes, Medicare covers diseases or disorders of the eye. But if you need to go get your eyes checked just to get glasses like I wear, Medicare doesn't cover that. Medicare allows for the plans to provide that benefit if they want to. So pay attention. Your plan very likely gives you an option to buy dental and vision coverage, or it'll provide it to you for free. Read carefully on your plan specifics. Hearing aids are a new thing. Veterans a lot of times get hearing aids because they had damage from military exercises, but Medicare doesn't cover hearing aids. But your plan might give you $1,000 or up to $3,000 a year for hearing aid coverage. That's a very popular benefit. But don't buy a plan just because it provides you dental, hearing aid, or vision. You got to make sure that your doctors and your drugs are covered first. That's the importance of an annual review. Number 3, 2020 was an interesting year in a lot of regards, but one of the interesting parts of 2020 was that Medicare relaxed the rules and said, hey, we're giving you $950 a month under the Medicare Advantage system. If you want to spend some of that money helping people with cooking or cleaning, Medicare said you can do this. How many plans decided to do that? Very few, about 1%. But it got some news in the media, and be careful, because some plans are experimenting, not guaranteed that that'll continue, with providing people with at-home care, even adult daycare, maybe once a week, to go to a facility so that the caregiver, the spouse, can get a break. But many plans are providing transportation services. Some of them are providing Uber coupons to go with Uber to get your vaccine. But a lot of the plans, many plans, are providing the over-the-counter medical items and also the meal delivery after hospitalization. But here's what Medicare is really going to pursue in a great amount is Medicare is funding extra money, not just $950 a month, but much more money for plans that pioneer treatments for chronically ill individuals and also pioneer services for low-income individuals. 5% of people spend 50% of the money, and low income generally means low health outcome. Now, chronic illness doesn't mean all chronic illnesses. They target certain ones, especially cardiovascular, so heart and lung, diabetes, including weight problems, which often comes with diabetes, and also kidney problems. So Medicare is spearheading and lasering down money for those populations that really are overspending, oftentimes accidentally, because the plans were not designed properly before, and we're trying to customize them for their needs. Very good growth area, expected to save Medicare a lot of money over time. So thank you very much for joining us today. I hope you learned a lot. Our services are free. There are no charge for our Medicare planning services and enrollment services and your annual reviews. We do all of that for free. My office is at 770-945-5261, and we're able to help you. But if you want to go learn on your own, go to our YouTube channel or go to our website, amsplans.com. Thank you very much. Have a great day.